When we talk about beneficence in healthcare ethics, we are talking about the moral obligation to act for the good of the patient. Beneficence asks a simple but demanding question. What does it mean to help another person in a morally responsible way? One of the oldest and most influential ways of answering that question is through what we call paternalistic beneficence. In this lecture, we will examine what paternalistic beneficence is, why it has been so influential in medical practice, how it operates in real clinical contexts, and why it has become one of the most contested approaches in modern healthcare ethics, especially because of its tension with patient autonomy. What is paternalistic beneficence? Paternalistic beneficence refers to an ethical approach in which healthcare professionals make decisions on behalf of patients, guided by their professional judgment about what will most benefit the patient's health, well-being, or survival. The term paternalistic comes from the Latin pater, meaning father. The model is intentionally parental in structure. The clinician assumes a role similar to that of a parent deciding what is best for a child. Under this approach, the clinician may override patient preferences, limit information, refuse requested treatments, or impose treatments, all in the belief that doing so protects the patient from harm or promotes their best interests. The key assumption is this: the healthcare provider, by virtue of training, experience, and expertise, is better positioned than the patient to determine what is medically best. Historical roots of paternalistic beneficence. Paternalistic beneficence has deep historical roots in medicine. For much of medical history, physicians were seen not merely as service providers, but as moral authorities. Patients were expected to trust the doctor's judgment, often without question. This model aligns closely with the Hippocratic tradition, the classical medical oath. The idea that physicians should do no harm and actively promote healing. Historically, patients were often not fully informed of diagnoses, shielded from distressing information, expected to comply rather than deliberate. In this context, paternalism was not seen as oppressive. It was seen as compassionate and responsible. How paternalistic beneficence works in practice. In clinical practice, paternalistic beneficence appears in situations such as a physician refusing to prescribe medication that a patient demands, but that is medically inappropriate. A clinician proceeding with life-saving treatment despite a patient's stated resistance during acute crisis. A healthcare team withholding certain prognostic details to prevent psychological distress. Emergency interventions performed without consent when a patient lacks decision-making capacity. In each case, the clinician's justification is the same: acting in the patient's best medical interest, even if that conflicts with the patient's expressed wishes. Strengths of paternalistic beneficence. Paternalistic beneficence has several ethical strengths. First, it prioritizes patient welfare. It ensures that vulnerable individuals, especially those who are confused, distressed, cognitively impaired, or overwhelmed, are not abandoned to decisions they may not be capable of making safely. Second, it acknowledges medical expertise. Medicine is complex. Patients may lack the technical knowledge needed to accurately assess risks, probabilities, and long-term consequences. Third, it can be life-saving in emergencies, where there is no time for extended deliberation and immediate action is required. Finally, paternalistic beneficence recognizes that not all choices are equally rational or safe, and that healthcare professionals have a moral duty to prevent serious harm when possible. The central ethical criticism: conflict with autonomy. Despite these strengths, paternalistic beneficence faces a powerful and sustained ethical critique, namely that it conflicts with the principle of respect for autonomy. Autonomy emphasizes the patient's right to make informed decisions, refuse treatment, define their own values and priorities, control what happens to their own body. From an autonomy-based perspective, overriding a patient's wishes, even for benevolent reasons, can be ethically problematic. Critics argue that paternalism treats competent adults like children, undermines patient dignity, disrespects personal values, risks abuse of professional power. The core concern is this: who gets to decide what counts as the patient's best interest? When clinicians assume that they know better than patients, even with good intentions, they may unintentionally silence the patient's voice. Modern ethical tension: beneficence versus autonomy. In contemporary bioethics, paternalistic beneficence is no longer the default model. Instead, it exists in tension with autonomy, requiring careful justification. Modern ethical frameworks typically ask: is the patient competent to decide? Is the patient adequately informed? Is there immediate risk of serious harm? Are the patient's preferences stable and voluntary? Paternalistic interventions are now generally considered ethically permissible only under limited conditions, such as lack of decisional capacity, severe mental illness, emergency situations, temporary impairment. Outside of these contexts, overriding autonomy is viewed with increasing skepticism. Soft versus hard paternalism. Ethicists often distinguish between soft and hard paternalism. Soft paternalism involves intervening when a patient's autonomy is compromised, such as confusion, unconsciousness, or coercion. This is widely considered ethically acceptable. Hard paternalism involves overriding the informed, voluntary decisions of a competent patient. This is far more controversial and generally discouraged. This distinction allows beneficence to operate without erasing autonomy entirely, but it also highlights how ethically sensitive paternalistic actions are. Conclusion: paternalistic beneficence represents one of the foundational approaches to healthcare ethics. It emphasizes care, protection, expertise, and responsibility, but it also raises serious concerns about power, respect, and individual freedom. In modern healthcare ethics, the question is no longer simply whether beneficence matters. It clearly does. The question is how beneficence can be exercised without undermining autonomy. Understanding paternalistic beneficence helps us see why ethical decision making in healthcare is rarely simple. It is a constant negotiation between doing good and respecting choice, between protecting patients and honoring their agency. And that tension lies at the very heart of contemporary bioethics.